Hello there, this is John Miller, the osteopath. I'm here to talk to you today about a client of mine who's asked me to do some exercises for her. She's quite immobile and she struggles to lay down on her back. She's had both sciatic problems and lower back problems in the past, and so I've got to try and give her something that she can do to keep her mobile in the meantime. And she's been given exercise in the past to sit. I'm really not that keen on the sitting exercises because that's a lot of spinal compression going through the body. So I want to focus on what I call side-lying positions. So the first exercise we're going to do is what's called a modified foraminal gapping technique. And you're going to need a pillow for this. In osteopathic practice, what we tend to do is we like to decompress the lumbar spine through here. We ask the patients to lay down on this side and we lean on their back and pull one side, so pulling through the shoulder and through the hip, and increasing the space of the vertebrae through here. And you can do this yourself. Simply place a pillow around waist height and lean over that pillow and lay down like so. And this pillow is now pushing my hip, so the hip is down and my lumbar spine is being pushed this way, opening up the spaces of the vertebrae, causing decompression. Now you can lay in this position. It may be comfortable for you just to stay like this, or you may want to change the actual angle of the pillow. You want to puff up a bit more, so it's a bit higher, or you can move it further down, even as far as the pelvis, like so, and you can use the added height of the pelvis to drop through and stretch this way. I personally prefer to do it like that, right in my waist. And what I now want to do is slide my leg down, like this, supporting, of course, my leg around where the knee is. You can bring it forward if you like, so you can drop off the edge. And with my other arm, I reach up as high as I comfortably can. Now many of you may not be able to reach up very high because you may have shoulder impingement. So therefore what you can do instead is simply let the arm go forward and roll a bit, introducing a little bit of rotation and a stretch to the upper part of the back here. Now combining that with the weight of the leg, we are gradually pulling this section apart. And as you lay here, breathe in slowly and deeply. Making sure you breathe out all the way. And really relax through. If you want to make this more dynamic, you can bring the leg into place. You can bring the leg back up towards you. Breathe in as you bring the leg up. And breathe out as you bring the leg out. Making sure to keep contact with the table the whole time. And breathe in. And breathe out. Really stretching that leg out as you do that. And breathe in. And breathe out. Do this for a couple of minutes, and over time you should notice that the pain in your back, and perhaps that maybe in your leg as well, starts to dissipate somewhat. Then continue to lay there for another few minutes, and when you're ready, gradually bring yourself back up again. Right, so without rushing, make sure you sit and rest for a bit before getting up. And try this next time you have any back problems. See you in the next video. Give me a thumbs up, like and subscribe.